What's the relationship like between neurology and psychiatry? So, this is interesting. So, first off, let me preemptively apologize to my neurologist colleagues because they are wonderful and incredibly smart and capable. The child neurologist and the adult neurologist that I know, they're just amazing people. So, I apologize beforehand because they use lots of um, definites and lots of science, and it's really cool because they have answers and they use scans and they look at things and they use images and they use tests and they find things, and it's really what we call concrete, meaning you can see it, you can feel it, you can touch it. And then concrete ideas are things that exist. Like if I put a yellow dye with a green dye, you're gonna yellow plus. Lord, is a yellow plus green makes blue, or I can't remember. But yeah, if you mix colors, there's a thing that comes out of it, and you know it, right? So pink and white, red and white make pink, and it's pretty universal, and that's just how it is. And that's very concrete. Well, whereas they deal more in the concrete, we deal more in the abstract. Abstract meaning it's kind of things that we use as our best guess, right? So, whereas red and white make pink, happiness and um, happiness plus grief equals complicated, right? And you can't see that, you can't feel it, you can't touch it, but we know that when you've lost somebody important to you, but you go to your graduation, you're happy that you're graduating, you're sad that they're not there, and it's a complicated feeling. And you have to sit in that. And then psychiatrists will become experts in learning to help coach people how to sit in that given their circumstance. Whereas neurologists, very much, yes, they are incredibly compassionate. They can do those things. It's just our training is a little bit different. Now it's really funny because we technically take the same board. So a board is a test that a doctor has to take to let other doctors know that they understand the material. And so they understand the special material, the specialty material. And so, like doctors take boards, which is just a big old test of based stuff. And so, an doctor could take the boards of other things, but you probably wouldn't want to do that because you're going to fail because you're not well versed in those other things like surgery or other things, and that's okay. It's the way that our training is set up is we're not designed to be taking a whole bunch of boards, taking a whole bunch of other specialties tests. But it just so happens that with neurology and psychiatry, our test is is the same. And so I learned a lot of neurology. I learned how nerves work and how blood vessels work and how blood vessels respond to nerves and how your brain and your nerves are connected through different tubes and links, and all about electricity and how electricity flows and how nerves talk to muscles and all that stuff. So all of that, especially that structural stuff, like things you can see, things you can touch, all of that is neurology. And so there are occasionally times when someone will come in and they will be telling me about a problem that I think is psychiatric, that I think is more abstract. And I'll go, no, this doesn't feel abstract. This feels like there's probably a structural thing going on, like a blockage or decreased electricity, like decreased electricity or something like that. And I will say, ooh, you need to go see a neurologist. And it's a fine line, because again, I mean, a heartbreak can feel like a physical pain. And so how do you know if it's the pain of a nerve not acting right or the pain of your brain missing that person? Well, you won't know until you talk to an expert that does this stuff all the time. And neurologists and psychiatrists can help tease those things apart. When it comes to how to get into those, so this is where our health system is dumb. And I'm going to say this again. We have a dumb healthcare system when it comes to how we access care. Neurology, because there's a structuralness to it. Again, you can feel it. It oftentimes gets lumped into the medical side of things and gets paid as a medical procedure or as a medical specialty. Whereas in psychiatry, we don't get lumped into that. We're kind of tucked off to the side, like we're not part of the family. And so as a result, we don't get paid like the rest of the family, and most people don't consider us like the rest of the family. And so it skews the number of people who go into those things. Now, and this is where I completely fail me, but this is where you can look at Google, the number of neurologists versus psychiatrists. I don't know what that number is. I don't know if it's higher or lower. But most times, neurologists are part of larger systems or groups. So, in other words, I haven't seen very many neurologists who are literally just practicing by themselves, because there's so many scans and so many tests and things that they do, where it's more cost effective for them to share those costs with other neurologists. So if you just Google neurologist, you're probably going to see a group name, or if you see an individual's name, they're going to be probably related to some group, like the neurologist of DFW or whatever. Whereas in psychiatry, a lot of psychiatrists work for systems, but quite a few more are in the outpatient world. They're just solo people in their own practices, because we can practice by ourselves. We don't have to really share those costs with anybody. And so you're more, you'll find a lot of psychiatrists who are just hanging a shingle, seeing their people, and going about their day. And so that can be problematic, because it may be hard to find someone if their name isn't on the internet, or if they're not affiliated with a group. And so that's another reason why sometimes it's quote unquote easier to find a neurologist, because they're in a system, whereas it's harder to find a psychiatrist because we're like solo shaman out in the in the desert doing our abstract thinking thing. Now the good part is, most neurologists, because they had to take psychiatry boards, and most psychiatrists, because they have to take neurologist boards, we tend to communicate with each other pretty well. For the most part, we get along fairly well, so that's fun. But there are times when I'm like, I don't know how we can improve things if we aren't speaking the same language. So that's where it's really important for all doctors to just keep up with what's going on in other people's specialty as best as you can. So continuing education is part of that. Talking to your colleagues is just a matter of being good sports, and building community is really, really important. And so, and then in some conditions, psychiatrists and neurologists work very, very closely. So seizures, mood disorders, chronic pain are kind of the three areas that pop up to me. Seizures, meaning sometimes when your certain brain cells are firing off electricity, because that's how your brain works. If it fires off too much electricity, then it can create a cascade of issues down the line, and sometimes that can affect your mood, and so or your personality and how you see things, or if there's an injury to your brain, like if something hits your brain, or you have a structural change from like a tumor or some type of infection, and so when that happens, the neurologist will cover the structure part. So either they will give you medicine to help thin your blood, or they will give you a medicine to turn down your electricity, or they'll give you a medicine to do whatever else needs to be done. Most neurologists don't do the cancer part. That's a cancer doctor, but then they'll bring in the psychiatrist to help with any of the mood parts, or trauma parts, or behavioral parts, because sometimes if people have an infection, or they have a concussion or head injury or something, sometimes folks can get really upset and aggressive, or have a very difficult time in the medical setting. And so psychiatrists can be helpful to swoop in and talk, or offer suggestions about medications and other things that could be helpful in the moment. And so those are some of the ways that we communicate. They are technically different things. We take the same boards. It is not something that I expect most people to understand or know. And so don't get upset if you're like, oh, I can't figure out if I should see a neurologist or a psychiatrist. The key is just get into either one, and that person can generally tell you, hey, you're in the right spot. This is exactly where you're supposed to be. Or, ooh, you know what? We need to work in concert alongside the other specialty. Or, no, you're wrong. Yeah, I mean, you're exactly in the wrong spot. You need to go see a neurologist or a psychiatrist because that's just what they do. So it's one of those three options. But generally, if you get in front of one or one of us, we can help guide you to where you need to go. And like I said, neurologists are awesome. I could not ever be a neurologist because I don't, I think my spatial awareness is off. Like they can look at a scan, look at MRIs and CTs, or look at muscle biopsies or EEGs, which are where they put those things on your head and they read where all your brain waves are and all that stuff. They can like read that stuff and they think it's fascinating. And I read that stuff and I go, this is not interesting to me in the least. And so, yeah. Whereas, again, I could sit and talk to you for a whole hour about your childhood, and I would love it. Whereas neurologists would probably, some of them may say, "Man, this isn't really interesting. I'd much rather see a scan of your brain." And so, yeah, and that's why it's really important to have a diversity of people in medicine and then a diversity of specialties and all that good stuff. And so that is the crux of neurology and psychiatry. The key is make sure that you reach out if you need help.